Welcome back, Kamloops neurosurgeon Dr. Richard Brownlee joining us back on the show again today from the Welcome Back Center. It's great to have you.
Thanks, Susan.
Yes.
It's nice to be here again.
Yes, we are talking today about back pain and neck pain, and many of us, 4 to 5 of us in fact, suffer from some sort of neck or back pain over the course of our life. I'm one of them. Apparently you're not. We just had this discussion. He's never had any back pain in his life, so you're very lucky. You're in the minority. Good for you. Yeah. So there's lots of different types of back pain. Some people never even really figure out, you know, my lower back, they don't even know what it is.
Yeah, a lot of people get what's called mechanical back pain, and I don't know that there's any good way of figuring out where that's coming from. It's probably a combination of pain from muscles, ligaments. You can get strained, like getting a kinked neck if you sleep wrong, that type of thing. So they're all quite common, but fortunately, most of them get better within a few days and go away.
But for the small percentage that don't, and that is sort of defined by pain that is 3 months or longer, is that right?
Yeah, chronic pain is defined as pain that persists consistently for more than 3 months. And like as a neurosurgeon, that's predominantly what we see in our office all the time. So I see hundreds of people every year with chronic pain.
What are the options? I know that worst case scenario, things end up in surgery, and sometimes that's unavoidable. But there are other options if it's not as serious as that.
Yeah, surgery actually works really well for people that have arm pain or leg pain because that's often due to a pinched nerve, and operations are good at unpinching nerves. Back pain, surgery isn't necessarily good for because it's often hard to figure out where that pain's coming from. So a lot of people go through investigations to try to figure out where their pain's coming from. So things like MRI scans. Doing injections to freeze different structures is probably the best way to figure out where pain's coming from because there's lots of different things that can be the source of pain.
So that would eliminate?
Yeah, it identifies the source. If you know where pain's coming from, then you're more likely to be able to do something for it. But things like physiotherapy, massage therapy, acupuncture, chiropractor, they all work very well for various types of back pain. And I always tell people all those things are out there because they all work for some people, but nothing works for everybody. So sometimes you have to experiment and find out what works for you.
We have some boards here. We went over the stats. We can just go by this one quickly. But yes, 80% of adults will suffer from some back pain during their lives. And then this one, most episodes of back pain are short-lived, as you mentioned. Chronic means more than 3 months. So people who are actually suffering from something and they just continually go on and they think it's going to go away, I'm kind of like that. Oh, it's going to go away eventually. Maybe it's worth getting looked at.
Again, with the way the public health care system works, people get referred to us, but it often takes a year or so to get an appointment with us, which is bad, but that's the way it is. But so we really don't see anybody with acute back pain. We just see people with chronic problems, and those are the people that go on to get other investigations like CT scans, MRIs. But the problem with doing those is that everybody gets degenerative changes in their back, and there's not a good relationship between what the pictures look like and what a person's symptoms look like. Like some people that have the worst looking back on an MRI have essentially no pain, and there's other people that have a perfectly healthy looking back on an MRI that have like disabling pain. So MRIs are good for showing people that the structure of their back is either good or bad, and then developing a plan of how to approach it, like physio or doing injections or surgery for some people. So I think it's a matter of, you have to correlate what pictures look like on the MRI and CAT scans with what a person's symptoms are like, and then determine whether you can help them or not.
Okay, and that's what this last board talks about, is the MRI. You guys have a standing MRI or something? What does that mean? How does that work?
Yeah, all conventional MRIs, basically everywhere, people lie flat on their back and go into a narrow tube to take the pictures. People that have neck pain and back pain tend to have more pain when they're upright and mobile or sitting than they do when they're lying down. Most people go and lay down to get rid of their pain. So I had seen this machine at a conference in New Orleans about 20 years ago and thought, well, it's perfect for diagnosing spine problems, and that's why we have it. We have the only one in Canada, actually. And so we image everybody with neck and back pain lying, sitting, and bending forward and backwards. There's a thing called instability where you see abnormal movement between the spine. And when they do back surgery on people, there's always a percentage that have what's called failed back surgery because they just don't get better after their operation. And I've always thought it's not because the surgeon's a bad surgeon, it's probably because they didn't have the right amount of information before they did the operation. So I think this technology helps us get as much information as possible.
Absolutely, because you know what you're going into.
Exactly.
When you see it ahead of time. Fantastic. Dr. Brownlee, thank you for being here today. Very much appreciate it.
Enjoyed it.
Good. Welcome Back Centre, of course, offering all kinds of different therapeutic remedies. Dr. Brownlee, of course, is there. However, there's other services there as well.
Yeah, we have physiotherapy, massage therapy, nutritional counseling, and I'm there. We do diagnostic injections. We have the MRI, so it's a pretty comprehensive place.
Awesome. Okay, 828-6740 if you would like to make a phone call, or welcomebackcentre.com. We're back in 2 minutes. Stay with us.